All right, welcome to the Inspired Yogi. Today I'm with Peter Stewart. Peter, welcome to the show.
Thank you. Nice to be here.
Great to have you. I appreciate you taking time to be here. Hey, Peter, please let our viewers and listeners know a little bit about yourself.
Well, I'm a massage therapist. I've been one for 32 years. I'm in Canada. I specialize in, well, I don't specialize in, the only modality I do anymore is light touch myofascial release. I've been doing that for 27 years now. And I work mainly with chronic pain populations. And I've been a teacher for 31 years. And I have my own seminar company. Now I teach what I want. Before I taught anatomy physiology, which was fine for a while. But for the since 2015, I've had my own company teaching light touch myofascial release.
Okay, and how does that differ from like a regular massage?
Well, traditional massage is usually done with Swedish techniques. So anybody who's gotten massage before knows it can involve oil, hands-on with the oil, and spreading that around and kneading the tissues and things like that. So it's a constant movement where this is about there's no oil involved, and I just put my hands on the body and I let them sink in until I feel like they're not going to sink any further, and then I kind of push them away until I reach a barrier of tension, which usually happens fairly quickly, and I wait there and I hang out until the body starts to release. I can start to feel the release under my hand, and then I follow it.
Okay, I have training in anatomy and physiology through nursing, but I'm sure some people have no
Yeah.
idea what myofascia is. Do you want to touch on
Sure.
that?
Well, myofascial release is really an umbrella term. Myo, of course, is Latin for muscle, and fascia is Latin for band. So most people think about it as the wrapping around the muscles. Myofascial release is, again, that umbrella term where there's a lot of different approaches to what somebody would call myofascial release. So there are a lot of aggressive types of myofascial release out there. And then there's more of the gentle approach, the intuitive approach, which is what I do.
Okay. Yeah, being a ex-yoga instructor, we used to do holding postures for a long time. They say would help to
Yeah.
facilitate myofascial release. Is that something that?
Yeah, that's basically the homework that I give out,
Okay.
is elongated hold, and trying to isolate the muscle as opposed to doing or the muscle area that I want to work with as opposed to more global release, which is fine too. But usually I have people hold for at least 2 minutes,
Okay.
and then beyond if they can, and not in pain. Up to the threshold of that tension, but don't go into the pain. Pain's just indicator from your muscles that you're, micro tearing the tissue, right? So,
Yeah.
yeah,
We like to say in yoga, comfortable discomfort.
yeah, that's a
Yeah.
great way of putting it. Yeah.
Yeah. Talk to me more about the myofascia because some people have said that the myofascia is the responsible for the tightness of the muscles, and without releasing the myofascia, you actually don't elongate and get the muscles to stretch.
So, from that perspective, fascia is the immediate environment of all your cells, right? It's the cell wall. And when I explain it to my patients, then you have a muscle cell wrapped with fascia, and then you have a bunch of these muscle cells brought together to create one muscle fiber, and that's wrapped with fascia. And then you get a bunch of these fibers brought together, and that's wrapped with fascia, and that's a bundle or a fascicle. And then you get a bunch of these fascicles brought together, banded with muscle, or sorry, banded with fascia, and that is your um, complex of the muscle. That's the outer fascia, which is also known as the fascia profundus, the deep fascia, because it's deep to the skin. So if you were to peel your skin off, you would see that. sort of saran wrap looking substance over top of the muscle,
Don't do
and
that at
which
home.
no, uh, leave that to the professionals. Um, so, but yeah, I mean, without because I've done a lot of um, um, cadaver dissection,
Okay.
and when you actually have a body without the skin on it, it's amazing to see how blended it is from top to bottom. It's just one unit, and uh, and it just flows from one area to another and connecting everything back to front, top to bottom, and encompassing all of the body, organs included, is the fascia.
Mhm.
So I would say that, yeah, if you have chronic tension, more than likely there's a fascial component to it, the fascial stiffening or patterns of fascial tension that have occurred due to, poor posture over time, or work, or injury, or traumas of various kinds.
Okay. So the traumas or bad posture held over a long time that causes changes in the myofascia tissue?
Yeah. So what will happen is, if somebody, let's take the desk jockey for an example. If your job is to be at a desk and a computer, you tend to have that head forward carriage, shoulders are forward, arms are forward, in your workspace on a regular basis. So 8 hours, 5 days a week, let's say, over 30 years, you will create patterns of fascial tension, within the pecs themselves that start to tighten and pull your head forward, because the pec fascia is actually attached up and around the mandible and through the neck, and so as this tightens, your head's pulling forward, your shoulders are pulling inward or rotating inward, and if you do this long enough, your brain is going to say, well, that's who we are. So every time you get into the task chair, your brain goes, "Oh, we're in the task chair. This is who we are in the task chair, right?"
Mhm. Yeah.
And yeah, so that tends to be what it is. You compound that with motor vehicle accident where you had whiplash associated disorder or something like that, and you can run into some serious tension patterns that will cause you issue.
That's really interesting that you said that your brain recognizes it's like, okay, this is what I am. Because I don't practice hatha yoga as much as I used to. And but now and then when I roll out the mat and get on it, I actually feel a physiological change in my body where my body's like, okay, here's it, it's time to do yoga. And I actually feel more flexible just getting on my mat and preparing to do yoga than I do throughout my normal day. And it's
Yeah.
like that same thing you were saying. It's like the body remembers, oh, okay, it's yoga time. Let's get flexible.
Yeah, it's interesting. I never thought about it from a perspective of flexibility. I usually deal with people who are in chronic condition and have multiple traumas. So I love that perspective. But yeah, that's what it is. And so the work that I do, as much as it is about releasing tension in the body through by releasing fascial tension, it's also brain entrainment, right? We've got to get the brain to let go of the pattern of holding on to who the brain thinks we are,
Hmm.
and as I said to my therapists when I teach, like, we're all stuck in these different patterns, and they're all unique to who we are. But if you're somebody who likes to recline at night and watch a little TV before you go to bed, I always say, which leg do you cross over the other, right? What's your pattern?
Yeah.
To relieve your low back and hip issues that you're not paying any attention to. I'm a right over left guy,
Okay.
and if you try to go left over right, it just does not feel good, and then you end up switching back, right? What is
Mhm.
that, right?
Yeah.
That's an ingrained pattern of tension, that where the brain is saying, yeah, no, we're good this way, but no, we don't like that. Why not? And why do I have to cross my legs? you know
Yeah. Yeah. It is fascinating. And I listened to a woman from she was a doctor from the University of Michigan, and she was talking about the idea that our muscles aren't really tight, our fascia is not really tight. It's really the nervous system. Um, this was her thoughts on it. Like if you undergo anesthesia, your body's totally flexible. There's no resistance, right?
Hmm. Hmm.
So her thing was that okay, it's the nervous system really. It's the body saying, okay, we're not safe to stretch or go here, or the repetitive signaling from the brain. So any thoughts on that?
Yeah, sure. I would agree with that. The brain, after you've experienced enough, trauma and postural tension and things like that, then there's something called Davis's law, which talks about how collagen is laid down continually in a pattern where you repeat the same sort of posture or same sort of movements, right?
Hmm.
And that's great. Like, I mean, if I'm a golfer and I'm taking thousands of swings a year, and I'm loading up over my left hip as I drive through the ball, um, you know, I will become a really proficient golfer because my body's going to tighten in order to allow me to make that more effortless and be better effective at that swing. But on the opposite, the hip is it's weak now, and there's an imbalance that's happened and compensation that's happening. So yeah, the nervous system will hold us into these patterns over time, but uh, if you put your hands on the body, I can guarantee you that there is a stiffness to the tissue. And but the fascia is embedded within the nervous system and vice versa. I mean, you know how I just described the layers of the muscle and the fascial layers around them. The same goes with your nerves, right? I mean, you have one axon wrapped with fascia, then you have a bunch of those axons wrapped with fascia, and et cetera, until you. So, your myelin is fascia. It's it's continuous throughout, and you're not going to see a lot of difference. So, the nervous system has a huge role to play in our stiffness for sure, but the on top of that, the muscles can become quite stiff and tight due to the fact that the fascia surrounding them has so much tension because there are patterns that your body has of this tension from the slip and fall you had, and you play hockey on a regular basis, and you shoot left all the time, and you know what I mean? Like it's
I
just
do.
unique to who you are.
Yeah.
But make no mistake, if you put your hands on the body, you can feel the difference between a relaxed muscle and a muscle that has trigger points or that ropiness of the tension.
Hmm. Yeah, I used to play hockey since you mentioned that. And in warm-ups, when I'd go out and warm up, I'd always warm up left-handed, um,
Okay.
just to help with the symmetry and the feel. And then it's interesting that when you shift to your dominant side, everything feels more effortless.
Yeah,
It's
yeah.
like your body's more confident and relaxed on going back instead of having to reprogram your brain to play the opposite hand. So.
Well, you're one of the few who would warm up like that, so that's great. You knew about balance. That's cool.
Yeah, yeah. In fact, I used to work with when I was teaching a lot of yoga. I would work with a lot of chiropractors, not a lot of chiropractors, a few chiropractors, and almost every one of them had scoliosis, um,
Hmm.
because they're all doing the same repetitive motion where they're
Yeah.
pushing on the body, to one side. So of course, the body tightens on that side and gets uh, the muscles get longer on the opposite side. So you're developing your own scoliosis. I went to a meeting with actually a group of chiropractors, and I'm scanning the room and I'm looking at all these chiropractors, and they all have different shoulder levels. There's
Hmm.
all very dominant or prominent signs of scoliosis because of that thing. It's kind of ironic to me that here's the guys working to fix your bodies, but their bodies are all trashed. So the one in particular that I worked with, she told me she had scoliosis. I said, "Oh, I can fix it." She goes, "Oh no, you can't fix scoliosis." I said, "Trust me." So over a few months, we fixed her scoliosis, and the main thing was having her after each client that she worked with, would she push on them a certain way when they'd leave the room, she would push on the bed in the exact opposite way, and that with the stretching and strengthening of the weaker and longer muscles helped her to correct her scoliosis.
Nice. Yeah, I mean, you want to counteract what you do on a regular basis, except most of us are pretty unconscious to it, right?
Hmm.
We just go and we do.
Yeah.
One of the courses I've developed over the years that I've written up a couple of years ago is called pelvic rebalancing, and I would say that a vast majority. I hate to give out a number, but
Hmm.
I'd say 90% of the people that I've seen over these years have a pelvic imbalance.
Sure.
And if you have one ilium higher than the other, there's scoliosis. I mean, the compensation that has to happen in the spine, and then of course the head and neck have to adjust for it, including the jaw. You know, the only bilateral joint in the body, and you can get TMJ dysfunction from imbalanced pelvis. And you also have one leg shorter than the other. So if you're working out on a regular basis, you're increasing the imbalance and the compensatory factors of so many muscles attached to the pelvis that have to abide by that. So it becomes a mess, and it's so overlooked. It's
Yep.
so overlooked.
Yep. Yeah. It seems like a lot of people that I talk to is like uh, the medical industry is like, oh, don't worry, we can put rods in your back and fix everything. It's like, what?
Uh, mhm.
A
Yeah,
little extreme.
a little extreme. Yeah, yeah. I don't usually advocate for a medical intervention in that way. I certainly will advocate for medicines and things like that. And
Hmm.
but I mean, surgery is the last thing you want. I mean,
Yeah.
I'm grateful for the really good orthopods who are out there. But hopefully you can see with different eyes and see as many people as you can until somebody tells you something where they say, "Hey, wait a second, what if we tried this?" You know,
Hmm.
and you know, you just got to keep looking. You
Yeah.
can't just jump to surgery.
Yeah. I agree. Yeah, I want to take you back to when you said, when you're working with a client, you put your hands on them, you put some pressure on them, and then you feel the release, and then you move to a different spot. Is it strictly like a pressure response from the release, or is there some energy work that's involved, or can you tell more about it?
Sure. That is really so. It's a piezoelectric effect. That's what it's been known
Okay.
as. You know, piezoelectricity, for those who don't understand, is basically pressure gets converted into energy. There are a lot of things that are piezoelectric. Even your basic Bic lighter is piezoelectric because the pressure that gets put down with your thumb creates that pressure down onto the crystal, which is inside, and creates a spark. So it creates a release of energy, which moves up into the chamber where the gas is and lights the gas. So anything that has a crystalline formation can have a piezoelectric effect. So when that gentle pressure is applied, you get that deformation of the collagen tissue. So the collagen is in this helix formation, and basically this collagen elastin complex that make up the fascia and the muscle. There's more, the balance is that there's more collagen in fascia than there is elastin, and in muscle, there's more elastin than there is collagen. So in the fascia, that collagen matrix or makeup is considered to be like a pseudocrystal.
Okay.
And when you change or disturb the fibers, there are charges released because it goes from balanced to unbalanced, and it's those charges that create that piezoelectric effect. In which case, you and now we know, as of 2021, the uh, Nobel Prize winners for science, Patapushin and Julian, these two researchers found that three new receptor sites on nerve cells, and one of them, the piezo 2, directly uh, shows a direct effect and cause of gentle pressure sustained will create this change in the nerve. And so that's where the release, I mean, it's been theory for years, decades. But again, now science has proven it, and it's lovely to see. So you get a change, you actually get electrical change from this. In fact, there was I'm not going to remember the name of the article. There was a Popular Science article just recently talking about energy of the body and the piezoelectric effect. You know, for years I've had to sort of defend myself against the naysayers of, there is no energy in the body. All right. Do you put your hands on the body? Do you feel what I'm feeling? And, you know, after 30, well, what do I say, about 30,000 hours of practical experience, I can tell you that change occurs when you put your hands on the body gently and move into that fascial area. So, um, the release work is it's science and it's intuitive because you really need to feel it, right?
Yeah.
So you
Yeah.
need to. The best way a therapist can show up is with a good intention and to drop in, right? So you drop in and allow yourself to feel and basically giving yourself permission to feel what is going on underneath you. So you don't show up aggressively trying to, um, you're deciding what the body needs. You're listening to what the body needs,
Hmm.
and you're allowing the body its due. So when it starts to release, you follow the direction it wants to release in, not the direction you think it should go in,
Hmm.
right? So, yeah, I hope that answered your question. There's probably a lot of stuff in there.
Yeah, yeah, it did. So you find you start off, do you always start in the same spot, or do you start off where somebody says that they have an issue?
Well, and you can start off pretty much anywhere, but and there are different types of techniques. There's arm pulls or compressions or leg pulls, compressions. You can put your hands on in the way that I described earlier. Or if somebody has, let's say somebody has a whiplash. And that's front and center what they're interested in. Most people have that plus other things going on when they come and see me. So if that's really what they want most relief with, I'll say, okay, so in the first session, let's start with uh, releasing your pecs because that pec fascia has such an influence on the head, neck, and jaw. And if it's pulling on your neck on a constant basis and not getting released, then there's a good chance you're only going to get limited results without affecting change there. So start with a single hand release on the pec and sink in and hit the barrier or move into the barrier and then feel that tension. I just wait and I wait and I wait until the such time the body starts to do its release. Now, from where I was here, people would feel pressure there, but then eventually they're going to start to feel it up their head, up the back of the neck, up, s- it, I've done pec release work, and somebody said, "Should I be feeling that in the back of my left knee?" Well, that's your pattern of tension, then yes, you know what I mean? Yeah,
Hmm.
so that's kind of how I would start, just working around the area that is most affected and then slowly working toward it.
Okay. Now, is this
But
something
I,
that, go ahead.
mhm. I was just going to say, but more than likely in the interview and assessment, we probably would have identified other areas that have deficits as well that are contributing factors to why this is even happening.
Okay. So is this something that, with your understanding that you can work on yourself somewhat? Obviously, you can't reach every part of your body to work on your back and different things, but if you wanted to work on yourself with pec release, is that something you could do?
Yeah, yeah, there are ways to release the pec and the neck and head tension, and even through the back, but it's limited, right?
Hmm.
You know, listen, I'd love to throw me on the table and work on me,
Yeah,
but I haven't been able to figure that one out yet.
yeah.
But that would be part of the protocol homework that I would give is learning how to do self myofascial in a way that's effective to get into those areas, including the pecs. Yeah.
Hmm. What about the hands?
Mhm.
Like if I want to relax my hands, my fingers stay curled.
Yeah, that's pretty natural.
Hmm. Yeah, because we're
And
always tightening the hands, tightening. We're never using the
yep.
strengthening to open the hands, right?
Yeah, and naturally the body has a curl to the. I mean, there's a flexion into the fingers as opposed to an extension.
Hmm.
Extension usually means there's a neurological something going on. But yeah, naturally the hands naturally go into that formation. So yeah, that's normal.
It's normal, but I mean, for some people, they get arthritis and it gets hard to open the fingers, and the
Oh,
muscles are tightening
sure.
all the time. Can you do myofascial release on the hands to help with that?
Oh yeah, of course.
And
Of
what does
course,
that
you can
look
do
like?
myofascial release anywhere. So I might take the hand and then open it up, almost like we're saying we're breaking bread, and just get to where I feel the barrier and allow the hand to start to open up. And then there's an unwinding process that can happen where the body starts to unwind itself,
Okay.
and you'll feel like it wants to move in certain directions, and you just follow it. And yeah, of course, there are exercises I would give to release that. And I'd probably, if you're that tight, I'd probably recommend getting a gua sha tool and scraping down the palmar fascia on a more regular basis. Are you familiar with the gua sha tool?
I had somebody use one on me once after a hockey injury. I think it was a calf muscle or a hamstring that he used it on. He said it was a Swedish technique where he just like brushed quickly over that area of tension. I think that's what
Hmm.
you're talking about, and it released.
Okay, I'm not familiar with that technique.
Oh, okay.
The Chinese are the ones who are the progenitors of the gua sha tool. That's basically a 5,000-year-old tool now, and comes in several shapes. The Chinese have had, I think, Bane stone is what is used now. The original stone from what was used before, when the movement would be happening on the body with the stone, would create a frequency.
Mm-hmm.
I think Banestone does create a frequency, just maybe not as much as the original stones that were used. And what I would do for that situation, Jim, is I'd get a gua sha tool that had a nice rounded edge to it,
Okay.
and then just work on scraping out the tension in the palmar fascia. I do very similar with the plantar fascia when people have plantar fasciitis. A really effective tool, uncomfortable, but I only do it for a couple minutes at a time,
Mm-hmm.
and but it's really great at getting rid of the built up scar adhesions.
Mm. Yeah, I can see that being really helpful. So many people have plantar fasciitis.
So many,
Yeah.
so many. Yeah.
So pretty much, I'm imagining everybody that comes to see you gets some relief, some benefit. You ever have
Yeah, for
people
the
that?
most part, I would say, um, you know, I I'm definitely not the be all and end all of anybody's healthcare.
Mhm.
But I would say that I'm an important link in their chain if they come and see me. I do an hour and a half assessment. I ask a lot of questions,
Okay.
and I do a physical assessment as well, including postural, where I can see, the actual patterns of the fascia showing up when people are standing and gravity is hitting them and the fascia is pushing up against that pressure. You start to see over a few minutes, the patterns of, as you say, one shoulder higher than the other, or rotations of the head, um, lateral flexions in the head. So start at the head, neck, move down. Um, Look at the pelvis, look at all of the anatomy, and then I take and put them on the table so where gravity is no longer a factor. And what are those patterns that still remain without gravity's influence? And that's where my red flags are. That's where I really want to get in and say, okay, well, these are some major areas that are stuck
Hmm.
and in these patterns, and we're going to have to address that. And that gives me the information that I can then talk to my patient about why we're doing this and what myofascial release is about, and how we would proceed moving forward with their permission and their understanding of, I want to make sure they have a really good idea as to what we're doing before hands get put on.
That makes sense. I'm sure it makes them a lot more comfortable as well.
Yeah, I think there's a sense of, I'm no stranger to pain myself, so I think there's a sense of trust
Hmm.
and understanding. It's really important for a lot of people who have been passed around for years, in some cases, that you get them, right? You see
Yeah.
them in
Yeah.
a way that other people haven't seen them before,
Hmm.
and you can talk about that right away. That establishes or it's a really good in for you to be able to get into their body systems and allow, like, when they trust you, it's a much bigger it's a much bigger difference than when they're unsure.
Sure. Yeah, I can see that happening. Uh, moving my table a little bit here. So the assessment's like an hour and a half. How long is the actual um, practice or therapy that you're doing?
Treatments usually last an hour. Um,
Yeah.
you know, sometimes I'm done what I need to do in less than an hour, so we'll go over some stretching or some other things that are pertinent to them. Um, and sometimes I need to go over the hour a bit because I'm not quite done what we needed to do. That's
Hmm.
kind of how it works. But we're all squeezed into a 1 hour time frame, aren't we? Most,
It seems like it.
this is
Unless you're a
society
doctor in an
wants us to
office,
be
then
in,
it's 15 minutes, right?
right? Yeah, exactly. So, yeah, yeah, that tends to be the way it goes.
Okay.
Well, some assessments, sometimes they're 2 hours, right? Some
Okay.
people come in and they've had a lifetime's worth of trauma,
Hmm.
and there's a lot to unpack,
Yeah.
right? So, especially the mental and emotional traumas that people have experienced, and whether or not they've worked through them, and how much of a factor they still are in the body's ability to heal itself.
Hmm.
So,
Yeah,
yeah.
when we think of trauma in the body, we often think of the physical traumas, the car, motor vehicle accidents, or whatever. But talk about emotional trauma a little bit and how that affects the body, if you would.
Sure. We know from Dr. Peter Levine's work years ago, a book he wrote, oh, I don't know now, maybe 40 years ago, called Waking the Tiger, talking about how the nervous system imprints mental and emotional trauma just as much as it does physical trauma into the tissue. Um, and he's the first person to coin the phrase post-traumatic stress disorder, right? And he and his colleagues do amazing work out there in Boulder, Colorado. And he was talking about how trauma is impacted into the tissue, but when we when you're hands-on and you're working with somebody and emotion comes up, that can be, that may have no connection to them. It might just be emotion. There may be no story behind that there, or picture that they see or something that happened. And it's oftentimes, something that might have scared us when we were a kid. Who knows, those kinds of traumas too. I mean, there's trauma from birth. There's, people grow up in abusive situations. Maybe there was an alcoholic in the family, and the alcoholic doesn't have to be a mean drunk, right? This could be a happy person, but they're drunk all the time, you know,
Mhm.
and we know that that can rewire the brain for the kids of that for that adult, for that parent. Could be that there are multiple head injuries involved and a slowing of the brain, and then you go to school and you're labeled as dumb jock syndrome, right?
Mhm.
Because you're slow and you can't understand the teacher as well. Back in my day, you were kind of mocked for that, you know. And I came to find out later that these are probably people who have suffered multiple concussions by the time they're 16, you
Mhm.
know, through sport, a lot of it, hockey, football.
Mhm.
That carries weight. Um, you can look at people's traumas from, did you grow up with a narcissistic parent? In one case, I had a woman who grew up with two. And I said, "What was that like for you?" And she just said, "Well, I did this," right? She just tried to handle the bombardment of negativity she got on
Mhm.
a daily basis, which leaves a mark. And how did she get out of it? A lot of people try to get out of it, through academia or through sports. And she went the sport route, and she became a very high level soccer player. And then she tore her ACL. And then her ACL, that seemed to be, she kind of fell apart after that because she couldn't get back to the level that she was at. So her identity now is her having to face herself. Who actually is she without sport? Who is this girl who has been taken so much and that sport had taken her away from that horrible life? And then all of a sudden, it's it's back, right? She can
Yeah.
no longer run away from that sort of situation. People go through so much suffering,
Hmm.
and it's so unique to the individual. But don't underestimate people who have been athletes for quite a while, and then all of a sudden an injury takes them out. It's like the rug gets pulled out from underneath you. I was one of those people. It took me 5 years to realize how depressed I was.
Wow.
And yeah, I just went about my business. Nobody said anything. Nobody said, "Oh, wow, you should really check in with that." I didn't hear that. Um, and then 5 years later, I found myself on the back steps of my my townhouse in Calgary, having a coffee and a smoke, and I went, "Oh my God, I don't smoke." That's when it hit me. It hit me like a ton of bricks. I was like, "Oh my God, I'm so depressed." And I didn't have a clue, just covered it up with, I was now a dad and a dad to two kids and married and doing all this stuff and doing. I didn't take enough time to sit and go, now who am I without the identity of being Mr. Ultimate Guy to now who am I?
Yeah.
So it was depressing. And I've caught that in a number of patients who said, "Oh well, what are you going to do?" I'm like, it's not oh well. It's it's important. And that's again just another one of those things that people just it's the shadow, right? The Jungian shadow. You just stick that in the closet and we'll look at that some other time or not. And just shove it in there with all the other stuff that you put in there, and it adds up over time, and then we're not feeling well, right? We're yeah, and then
Yep.
you're not healing, right?
Yeah.
And then you've accumulated enough trauma, mental, emotional, and physical, that your body is no longer responding to the traumas that are occurring now. In fact, you're in fight flight mode.
Hmm.
So, so yeah, I need to try to get as much of that picked up in the interview as I can, and help place people where they need to be. If you've had some issues with that you haven't been able to deal with psychologically, then it's time, right? Because that's keeping you from being able to heal your stuff.
Hmm.
And maybe it's nutrition, and you need to see a naturopath or a good nutritionist because you're eating so poorly and you're not, or maybe you need to see the doctor because you've got you're not sleeping and the melatonin and the CBD and everything isn't working. Well, maybe it's time you got some medication, and that's what it's there for, short-term use, so you can move through what you need to move through. So there's a lot of stuff to take a look at with any one individual and make sure, because if you're not healing, if you're not getting better and you're on my doorstep, then we something's been missed and we got to figure that out,
Hmm. Yeah. I
because the
love the
body's a
thoroughness that
self-correcting
you.
mechanism,
Yeah,
right?
I agree. Or destructing if
Yeah,
not treated right.
yeah.
So, any are you bringing in meditation or breath work at all to your homework or practice, or any studies on that with myofascial release?
No studies that I know of,
Okay.
but from my own personal journey, breathwork is vital. And I do ask my patients to breathe. Some of them are already like, 20 years ago, uh, people were like, "Oh, breath work." And now it's more, you say breath work and people are like, "Oh, yeah, okay." And it's more accepted. It's more because more people are doing yoga, more people are doing more mindfulness work. And meditations and things like that. So I do ask them, if they do any of that type of work, and I'll keep that in mind as we move along and try to add the pieces that they may not have to them. But yeah, a really important part of just your daily living.
Yeah. Man, sounds like you're doing amazing work with people, and those people that are getting to see you. I think they're blessed. Yeah,
Oh, thank you.
yeah. So any as we're getting close to wrapping up here, any advice that you want to give the audience, those that are going to watch on YouTube or listen on their favorite podcast app?
Any advice in regard to
Uh,
up,
anything that you want to
up,
put out there, anything you want to share?
open-ended?
Yeah.
You podcasters, you always throw one at the end, don't you? Any advice? Yeah, don't wait. If you're feeling, if you're in a situation that feels like it's compromising who you are, you need to get out of it, right? And it's not a matter of it's going to resolve itself. It's going to, no, you are the one you're looking for, right?
Hmm.
You're the hero of your journey. You need to pull yourself out and get help wherever it's necessary, and find the people and plug into them that will bring you back to nurture. And too many people hang on for so long before, I mean, they'll even let marriages go, and it's just it's incredible how much people will hang on to their stuff and not want to look or face it. The sooner you do, the better life will get, and that's a guarantee. And seek out those people uh, who can help you.
That's great advice. Um, so I'm assuming this isn't work that you can do online. You've got to be one-on-one with people, correct?
Yeah, I don't do any work with patients one-on-one. I mean, I do some consulting and stuff like that. Certainly through the pandemic, I did,
Hmm.
and demonstrating things awkwardly. And it's just like my seminar company. It really is in-house. I'm going to develop a couple webinars over the next or over this next year. But it's not about the hands-on because I need you to be in class with me to really get the intuitive feel about what we're doing. I'd love to be able to put courses online and say, hey, sign up for my course online.
Yeah,
It you come to Nova Scotia, you know,
there you go.
and or build me a course. I will, or build me a class, and I'll come to your city. But yeah, I'm willing to travel. I want to see more and more people doing this style of work and coming from this perspective that we're
Hmm.
treating the entire being. We're
Got it.
not treating the
Okay.
symptoms.
Yeah. Well,
Yeah,
Peter, I want to thank you for taking time again to be with me today, and for our listeners, I'm sure a lot of people are going to get a lot out of this. So, thank you
good.
so
I'm
much.
glad. I really appreciate it, Jim. This is a great little website, or podcast. I love it. I
Thank
love
you.
the background too.
Oh,
You,
thanks.
yeah, very organic. I love it. Not like
That's
mine.
my wife's touch.
God bless. God bless her. Yeah, yeah,
She's
yeah,
like, your
yeah.
background sucks.
Nice. Yeah.
Yeah,
Where would I be without my own wife? Yeah, for sure.
right. Yeah.
Yeah. Well, I
All right.
appreciate it. Thank you.
You're welcome. Thank you. You have a great day.
Yeah, you too. Cheers.